We all know pain. The painful experience, the painful procedure, the painful injury, the pain in the neck. We lump pain in categories: chronic, acute, emotional, phantom, psychological. Yet pain is so difficult to articulate. In the introduction to his extraordinary book, Listening to Pain, the physician and author, himself a patient, David Barrow, writes, "Language and pain seem as far apart as the opposite poles of an electric current. While language can capture much of the diverse range of human experience, it fails us in the case of pain. And pain is usually invisible. It's difficult for us to recognize or remember when we do know that someone is fighting a physical or emotional battle, an exhausting battle." We've responded to the challenge of expressing pain with several approaches: dance, humor, candor, and tragedy. The stories are real and true.
Pain is whatever the person experiencing it says it is, and it occurs whenever they say it does. And so that's a very common definition that's used, that was developed by Margot McCaffrey. And there's also the International Association for the Study of Pain definition for what pain is. And I can't quote that word for word, but it's an unpleasant sensory and emotional experience, which is experienced because of potential tissue damage or actual tissue damage. And so those are very clinical sort of definitions of pain. But in my practice, pain is whatever the person says it is, and it occurs whenever they say it does. It's a very individualized experience. It's a very subjective experience.